Once again, I am Flora Abdullah Manalulong, a nursing student at MSc Main Campus. So for today's video, I will be assessing the abdomen. So the definition of it is the abdomen is bordered superiorly by the costal margins, anteriorly by the symphysis, pubis, and inguinal canals, and laterally by the flanks. So the purpose of it is to assess abdominal pain, tenderness, or masses. So the equipments are tape measure, skin marking pen, stethoscope, and gloves. So considerations before, during, and after the procedure: introduce self, verify client identity, and explain the procedures, perform hand hygiene, and provide for the client privacy. Things to document after the procedure: document all findings, normal and abnormal response of the client to the procedures.
Assessing the abdomen. First procedure, place the client in a supine position with the head and knees supported with small pillow or folded sheets with drapes positioned accordingly. It allows relaxed abdominal wall musculature. Examine the abdomen in this order: inspect, auscultate, percuss, and palpation. Abnormalities detected on inspection provide clues to intra-abdominal pathology, which are further investigated with auscultation and palpation. Inspect the abdomen for size, symmetry, and contour. Observe the condition of the skin and skin color, hair distribution, and any presence of lesions, scars, stray, and superficial veins. This is to note for any abnormalities. Taking note of surgical scars, which should be correlated with the previous operations or veins. Note the position, contour, and color of the umbilicus. It should be inverted and located in the abdominal midline. Ask the client to raise his head without using the arms for support. This is to check for any bulges or hernia. If this tension is present, measure the girth at the umbilicus with a tape measure, noting for generalized or localized destination. Auscultate the abdomen for bowel sounds using the diaphragm of the stethoscope. It should be applied on the abdominal wall with firm but gentle pressure. Listen for bowel sounds for 3 to 5 minutes to note presence or absence of bowel sound. Place the warm diaphragm in each of the 4 quadrants of the abdomen. This is to determine presence or absence of bowel sounds. Use the bell of the stethoscope over the aorta, renal, and iliac arteries to listen for bruits. Bruits are swishing sounds heard over major arteries during systole, or less commonly systole and diastole. Percuss several areas in each of the 4 quadrants. Use a systematic pattern. Begin in the lower right quadrant. Proceed to the upper right quadrant, the upper left quadrant, and the lower left quadrant. This is to determine presence of tympani and dullness. Palpate the abdomen over all 4 quadrants. Begin with light palpation, then do deep palpation to palpate organs or any masses. It gives some ideas as to areas of masses or tenderness. For light palpation, pressure palm down only about 1 to 2 cm in a rotating motion. Note areas of slight tenderness or superficial pain, large masses, and muscle guarding. This is to note presence and location of any abdominal pain to point to the area of greatest pain. For the palpation, use the bimanual method. Depress the abdominal wall about 4 to 5 cm. It may be helpful in evaluating a mass. Palpate the liver. Place your right hand at the mid-clavicular line under the 11th or 12th rib. Place your left hand under the client's back at the lower ribs and press upward. This is to be able to properly locate the liver and be able to check for any tenderness or abnormalities. Ask the client to inhale and exhale deeply while pressing in and up, noting for any enlargement or masses. Document the procedure done and findings.